In today's video, we have prepared a comprehensive content about ovarian cancer. We hope it will be a useful and informative video for you. Ovarian cancer is one of the deadliest types of cancer in women and is very difficult to treat, if not detected early. Therefore, it is very important for women to have regular checkups. In this video, we look at the symptoms, causes, and treatment of ovarian cancer, and other details you need to know about it. We also discuss which age groups are at risk and which tests should be done. If you enjoyed the video and found it informative, please don't forget to like the video and share your thoughts in the comments. You can also support us by subscribing to our channel. Let's get started now. Ovarian cancer is the uncontrolled growth and multiplication of cells in the ovarian tissue. Ovarian cancer occurs in women because they have ovaries. The ovaries perform all the functions responsible for reproduction in women. The ovaries have a cyclical working mechanism that allows the production of different hormones at different times depending on the age of the person. Therefore, ovarian tissue consists of cells with different functions and structures. In ovarian cancer, tumors can form as a result of uncontrolled division and proliferation in the epithelial cells that form the main structure of the ovary or in cells from the embryonic period. Ovarian cancer often occurs with tumors originating from epithelial cells. The incidence of ovarian cancer increases with age. A significant proportion of people diagnosed with ovarian cancer after menopause are diagnosed with tumors formed in epithelial tissue. On the other hand, tumors from the embryonic period can be encountered in childhood and during the period of fertility. Ovarian cancer occurs in an average of 1.4 out of every 100 women throughout their lifetime, while 80 to 90% 5-year survival rate can be achieved with appropriate treatments in the early period in ovarian cancer, which is mostly seen in the postmenopausal period. This rate decreases to 30% in the advanced period. Therefore, it is important to recognize and treat ovarian cancer in its early stage. As with other types of cancer, the causes of ovarian cancer are not clearly known. Approximately 5 to 10% of ovarian cancers are caused by genetic reasons. Therefore, women whose first-degree relatives have breast, ovarian, and intrauterine cancer are in the risk group for ovarian cancer. As with most types of cancer, advancing age increases the likelihood of ovarian cancer. The ovaries perform differently and function differently during puberty, adulthood, and menopause. Ovarian cancers usually occur after menopause. Although menopause means the end of the fertile period, the ovaries continue to function. Therefore, it is important to undergo regular medical checkups during and after menopause, both for the quality of life and for healthy ovaries. Cancer is caused by the unusual growth and proliferation of cells in the tissues where it is found. The ovaries, like other organs of the body, are affected by our general health. Healthy living habits, regular exercise, and controlled stress levels are important for maintaining the health of the ovaries and the whole body. Ovarian cancer risk factors can be listed as follows: advancing age, being over the ideal weight, having given birth late or not having given birth, having received hormone therapy after menopause, family history of breast or ovarian cancer, genetic predisposition, use of ovulation-enhancing drugs, infertility treatment, having had breast cancer, and smoking. Ovarian cancer does not have a highly specific risk group. Regular medical checkups, sharing your medical history with your physician, and adopting regular living habits are preventive measures not only for ovarian cancer but for all diseases. It may not be easy to recognize the symptoms of ovarian cancer. In the early stages, ovarian cancer may not give a distinctive symptom in the early period. For this reason, only about 20% of ovarian cancers are detected at an early stage. The reason for the late onset of ovarian cancer symptoms is that the tumor tissue grows in the abdominal cavity and does not bother the patient for a long time. However, there may still be widespread complaints of increased intra-abdominal pressure. The symptoms of ovarian cancer can be listed as follows: feeling of bloating due to increased intra-abdominal pressure, swelling, or pain in the groin, fatigue, feeling tired, gas, and digestive problems, nausea, prolonged constipation or frequent urination, loss of appetite, feeling of fullness despite hunger, vaginal bleeding different from periodic bleeding. Sagging, hair growth or hair loss during menstruation, unplanned weight loss, low back pain, pain during intercourse, since the symptoms of ovarian cancer often do not appear until the cancer is in its advanced stages. It is important to go for regular checkups. When ovarian cancer is diagnosed early, the success rate of treatment increases. There is no single method to diagnose ovarian cancer. The disease can be diagnosed in many ways. In some patients, the diagnosis is made during investigations and surgeries for other reasons. Therefore, patients with the complaints just mentioned should definitely be examined by a gynecologist. During or after the examination, pelvic ultrasonography is performed to evaluate the suspicion of the presence of the disease. The definitive diagnosis of ovarian cancer is made after pathologic examination of the tissues removed by surgery. In addition, tests for certain substances called tumor markers in the blood are also used as an auxiliary diagnostic method, as mentioned above. Since ovarian cancers do not show symptoms in the early period, annual gynecological examination and groin ultrasonography, especially after menopause, can provide early diagnosis of the disease. In this context, postmenopausal controls are important, because 75% of ovarian cancers are seen in the postmenopausal period. As with all types of cancer, early diagnosis of ovarian cancer is an important factor affecting the course and success rate of treatment. Since ovarian cancer does not give typical symptoms in its early stages, it is of great importance to visit a doctor regularly. Ovarian cancers are mostly detected during menopause. Therefore, the health of the ovaries should be taken into consideration at any age. Not only during reproductive periods, ovarian cancer is treatable, but it is also a fatal disease. Early diagnosis increases the success rate of treatment. Not every cyst in the ovaries means ovarian cancer, nor does it cause ovarian cancer. Whether these cysts are malignant or not can be determined by a physician's examination and tests. Many non-cancerous cysts are harmless. Monitoring, leaving, or removing these cysts depends on the physician's evaluation. Ovarian cancer is staged just like other types of cancer. Depending on the stage of the disease, different treatment methods can be applied. In the early stages, when the disease progresses asymptomatically, it can be detected by routine checks or due to another complaint. At this stage, the cancerous tissues are located in one or both ovaries or fallopian tubes. The tumorous tissue has not yet spread beyond these areas. The specific name for the stage in which cancerous cells have spread only within one ovary or fallopian tube. In this stage, the cancer has spread to both ovaries. However, it has not yet spread outside the ovary. In this stage, cancerous cells are found in one or both ovaries, fallopian tubes, but tumor cells are found in the intra-abdominal fluid or in the washing fluid, obtained during surgery, or in the rupture of the tumor capsule during surgery. The cancer has spread beyond the ovaries to organs in the pelvic region or is located in the peritoneum. At this stage, in addition to the ovaries, tumorous tissue has spread into the uterus, fallopian tube or other ovary. In addition to the ovaries, the tumorous tissue has spread to the large intestine, rectum or bladder. The cancer has spread to nearby organs in the pelvis. In addition to the ovaries, tubes or peritoneum, there is only spread to the lymph nodes behind the peritoneum. The cancer has spread to organs outside the pelvis, in addition to the ovarian tubes or peritoneum. But there is no cancerous tissue visible to the naked eye in the abdomen at the time of surgery. Cancerous cells are identified by laboratory examination of samples taken from the abdomen. Cancer has spread to organs outside the pelvis, in addition to the ovarian tubes or the lining of the abdomen. The spread is visible to the naked eye but is smaller than 2 centimeters. It may or may not be present in the lymph nodes behind the peritoneum. Cancer has spread to organs outside the pelvis, in addition to the ovarian tubes or peritoneum. The spreading tissues are visible to the naked eye and are larger than 2 centimeters. Cancer cells are found in the thoracic cavity fluid, but there is no involvement of the liver, spleen, intestine, or extra-abdominal lymph nodes. Cancer has metastasized to the spleen, liver, extraperitoneal lymph nodes or extra-abdominal organs. The first treatment of ovarian cancer is surgical treatment. In other words, patients are first treated with surgery. The response of the disease to treatment is directly related to the adequacy of the first surgery. In the early stages of the disease, an operation called staging surgery is performed with the removal of the tumor. In advanced stages, tumors in the abdominal cavity are removed in a comprehensive surgery, if necessary. Parts of the intestine may also be removed during the operation. After surgery, all patients, except for those in the very early stages, receive a drug treatment called chemotherapy. In other words, drug therapy is applied in a significant part of ovarian cancer treatment. The response of the disease to treatment is directly related to the extent of the tumor. While 80 to 90% of early-stage diseases are cured with treatment, the cure rate in advanced-stage diseases is around 40 to 50% after surgery and chemotherapy. Patients are checked with examinations and tests every 4 to 5 months for many years. When the disease recurs, the treatments need to be repeated. Sometimes surgeries may even need to be repeated 2 to 4 times. You have learned about ovarian cancer by watching this video. Ovarian cancer is a disease with a high chance of cure when detected early. Therefore, it is vital to have regular gynecological examinations, follow possible symptoms, and avoid risk factors. It is also important to exercise regularly, eat a balanced diet, and avoid smoking and alcohol. Take care of yourself for a healthy life. Thanks for watching. Wishing everyone a healthy and meaningful life.